5 minutes past 8 a.m. We do continue with Friday's edition of Morning at NTV. I am Priscilla Regina Naloga, and once again a warm welcome to you who has just tuned into Morning at NTV. We're going to be taking notes on some health-related matters. Of course, COVID-19 was at the peak right there. Now we do have Ebola that is registering more deaths as we speak today, Friday. In just a span of 5 days, things are, moving so fast in terms of that outbreak, and of course that's a conversation we're going to be having later on. But today we want to have also another conversation regarding your heart and the state of your heart, but also certain heart conditions that are prevalent here in Uganda. According to the World Health Organization data published in 2020, coronary heart disease deaths in Uganda reached 8,784 deaths, or 4.23% of the total deaths. The age-adjusted death rate is 82.33 per 100,000 of the population ranks, and Uganda is ranked as 131st in the entire world. And that definitely is also causes you to think like exactly how are we ranked that. And we're going to be having an answer to that. But in regards to the heart diseases, they differ in Uganda, and many have been silently dying from such conditions. We are going to be diving deeper into the seriousness of the disease, and I do have Dr. Vijay Patil, who's the Chief Interventional Cardiologist ahead of the International Heart Disease Day that is always celebrated on the 29th of September. Good morning to you, Doctor.
Good morning, and namaste and jumbo to all Ugandan people. Hi.
Hi. Okay, so first tell us about, interpret these statistics for us, because the adjusted death rate being 82.33% per every 100,000 people in this population of about 46 to 47 million Ugandans.
Yes, actually when I started working in Africa, mainly in Kenya, initially people were thinking there is no cardiac issues, not much cardiac issues. But when we analyzed and when we studied the statistics, definitely in ICU nearly 50% or 25% deaths are because of heart problem. And looking at Uganda perspective also, it's quite high number of the patients which are undiagnosed. Basically they are undiagnosed of myocardial infarction, that is heart attack. They are undiagnosed of they are having the hypertension or the heart failure, and they are not treated in time, and that has to lead to the such a huge mortality. And the risk factor nowadays modernization, we are accepting westernization things, and alcohol, smoking, all that has increased, and that has precipitated all this non-communicable disease pandemic, you can say. What we got, it's communicable disease, what was the COVID, and this is called non-communicable or not transmissible, but still having the high mortality.
Okay, all right. Tell us about the different heart conditions that are prevalent in Uganda, because I know in infantry there's the babies every now and then that are born with heart conditions. I've seen them in Bulago, and yet there's also those other diseases that come with time over maybe a course of activities or engagements that are harmful to the body. So could you give us the variations there?
So in heart disease, basically there are variety of diseases, mainly congenital. What you are talking, it's a congenital, by birth defects some baby will have. Some patient will get over a period due to the risk factor like hypertension, diabetes, cholesterol. All that lead to the blockages in the heart vessels, that is called coronary artery disease. And due to continuous strain on a heart, patient can land up into the heart failure. So we can divide disease during childhood. Those are usually the congenital, like hole in the heart, ASD, VSD, those kind of diseases. In adolescent or in adult age group, mainly younger age group between 20 to 40, they will have very common is the hypertension related heart failure, blockage related diseases like myocardial infarction and heart attack. and ultimately older age group will have again the diseases of same, which has causing more damage to the heart and ultimately land up into the heart failure. Even in younger age, valvular heart disease also is very common. Rheumatic heart disease is very common in Uganda specifically. We are doing a lot of mitral stenosis diagnosis in these local patients. So definitely the valvular heart disease, congenital heart disease, heart failure, heart attack, all these variety of the diseases are there in the our East Africa population, and basically we need to tackle them with age group perspective and the long term good benefit from that.
Okay, all right. What do you then help people interpret of the condition whereby, for example, a 30-year-old is experiencing heart attacks at that age, and it's not one, they tend to be continuous?
Yes, it's a very good question actually. Young patient who is actually backbone of a family, and if somebody is getting heart attack at age of 30, and he will gradually get either sudden cardiac death due to the heart attack, or he will get repeated heart attack as you said, and for that definitely you need to have the screening. That's what we are starting as a Medihill group of hospital. We are starting cleaning in Kampala also, and we have the state-of-art cardiac facility in Nairobi, Medihill Parkland, and where we are treating such a patient first in the ICU if they are having ongoing chest pain or heart attack, and then we usually diagnose the blockage in the heart blood vessel through the angiography. Angiography is a small procedure from the hand vessel or leg vessel. We put small cannula, and through that we pass small tube till the heart blood vessel, and where we are giving the injection, and through that we can see the blockages, where exactly block is there, and we can treat without any cutting on a cut on a body by just a small prick, and we can open that block with a balloon and we can put stent. So that is the more definitive and currently gold standard treatment for the heart attack, what you are saying. If you are not treating that in time, patient can get repeat heart attack, and a repeat heart attack definitely will worsen the heart condition. They can land up into sudden cardiac death, heart failure over a period.
Okay, so with that kind of treatment, is it a guarantee that it can be a cure to a young person who's been having repeated heart attacks?
Yes, definitely.
Okay.
Because we are looking at the cause, exactly what is happening inside the heart blood vessel. We are looking, and we can see where exactly block is there. We can open that block with angioplasty. It's called primary angioplasty. Whenever we are doing the angioplasty in a patient who is having ongoing chest pain, there are ECG changes, and during that time if you treat such patient, definitely the patient's life will save, heart damage will get prevented. And for this we usually call as time is a muscle for the heart. If you treat in time, definitely the heart muscle will get preserved, no damage will happen. Okay. It's a simple thing, like in a hand, it become red because it's having blood supply. If you cut down the blood supply, hand will become black and useless.
Okay.
Same way for the heart, if heart blood supply is getting cut down, that part of the heart will get damaged.
Okay.
And prevent that damage, we need to open that blood vessel by doing this procedure.
All right.
And we are doing this angioplasty since last 1 year. We have started cath lab in Medihill, Nairobi, where we have done more than 1,000 cases of such patients.
Dr. Patil, so this can only be done in Nairobi for now?
Yeah.
Okay. All right. So this brings us to the cost of treatment of heart-related diseases. We've had so many people here in Uganda being referred to India, and so we want to find out from you, is that is this because maybe costs of treatment in India are cheaper, but also the technology that has been adopted by the country of India in regards to this disease is high and able to deal with these conditions? And then if that's the case, what do these costs come down to you when you are bringing the service closer to Kenya?
Medihill, as our Honorable Dr. Mishra, who has started this Medihill group of hospital, we are bringing the India into the Africa instead of patient going from the Africa to the India. Because India will be the alien land for the African people, and it's better we should treat them in their native place where they are suffering. And if we treat them with close their family, everybody is around, and it will give good relief from the disease. And in Medihill we have started bring a lot of cardiac technology, all the state-of-art cardiac cath lab we have. We have majority staff who are trained for 10-15 years in India to deal with the cardiac patients. We have brought them, we are training our local staff from here, and we are trying to give the best service at very affordable rate. Okay. Because if we are looking at the cost of travel, cost of the stay outside of the country, and if you are giving them same service and same treatment in time, that's most important for the heart. If we delay the treatment, it can cause worsening of that condition, and that's why we should do it in a time. So you can see in video, I guess we are, I'm doing the procedure, it's called angiography. It's just small prick on the groin or in a hand, and through that we are doing these procedures. And you can see the beautiful cath lab we have at a Nairobi Parkland, and it is having all what you are expecting in US or UK. All that technology we are bringing. We can see the blood vessel from inside by some newer technique called IVUS or OCT. Through that we can see from inside also the vessel. We can treating the heart valves, we can treating the heart failure conditions, and it's at a very affordable rate with high quality. Okay, that's most important.
All right, let's talk about International Heart Day, and how significant is this International Heart Day to Ugandans in particular, and more so, what is the theme for this year?
World Heart Day usually celebrate on 29th of September, and it usually in East Africa now motto is to prevent non-communicable disease, and in non-communicable disease topmost is a hypertension and heart disease. And the motto of this year is to prevent the risk factor which are leading to the heart failure, heart attack, and control those the risk factor. That is the main motto for celebrating any day actually. It's not the treatment. Treatment is after suffering of disease, but prevention is always better, and that is the motto for this World Heart Day actually.
Okay, prevention is always better than cure. So how best can one prevent themselves from actually getting heart-related diseases?
Yes. Now, heart-related disease, what I told you, it's a congenital we can't prevent because they are genetically. But those are like heart attack, heart failure, hypertension, diabetes. Those we can prevent by the lifestyle modification, which is the most important, like weight reduction. If you eat well, if you see before eating, like you should eat fruits, salads instead of excess red meat, excess salt, excess oily food, you should cut down them, and be active. At least you should do any kind of aerobic activity like walking, running, jogging, swimming, any kind of activity at least 30 to 45 minutes per day, at least 5 days in a week. That is what WHO guidelines. But at least you should active even at work. When you are even working in a place, you should get up and work, do some exercise after each hour. That is also best way to be active. And most important, avoid the alcohol smoking. Okay. So I always tell A, B, C. First, A is for avoid alcohol smoking, B, be active, and C, cut down all the fat you are eating excess.
All right. Finally, I want to find out from you, especially for newborn babies that are born with this condition, how best and at what point can it easily be detected, or what medical procedures should parents actually look out for when they are receiving their newborns?
Yes. Congenital heart disease is always critical issue and sensitive issue for a family. So in a way, world is going that they are diagnosed in a womb only with fetal medicine technology, that during the patient baby is inside mother's womb, you can diagnose, you can do the fetal echo and see any defect. That is the latest thing what is happening. But once baby born, you should be prepared that if any abnormalities, abnormal signs in baby, like excess sweating, if baby is not feeding well, not gaining weight properly, if any bluish discoloration of the nails or lip, and weight gain is not proper, the milestones are not proper, you should check baby by the echocardiography. Echocardiography can show the structure of heart. Is there any hole in the heart? Is there any problem or connection, congenital abnormalities in the heart? You can see them, and you can treat them by in time before development of lung pressures become very high and they become non-operable stage. Before that we should do it. And I have closed one hole in the heart of 11 months of baby also. So that will give, and that without surgery we can do by intervention cardiology, that we can do from the femur leg veins or hand veins. We can see the hole by echocardiography, and in cath lab we can close them and give the permanent cure without any scar on the body. And if some diseases where surgery is required, that also we are providing. We have two good cath lab with cath lab and cardiac OTs, where we are doing the surgery over the congenital heart disease, surgery over bypass surgery or open heart surgery. So we have more than 10 years, 15 years experienced surgeons with us.
All right. Tell us about the valve heart condition.
So valve in developing world, per se rheumatic heart disease is very common, and rheumatic heart disease can lead, rheumatic heart disease is what, whenever child or adolescent who is getting repeated sore throat, that cause the infection, and that infection again replicate into the heart valves, and eventually it will get damaged. Either it can get stenosed or it can get leak. Whenever it's stenosed, we can open by the balloon. It's called balloon valvoplasty. And if it is leakage or if any problem where the valve is not working well, we can replace also it by open surgery. So we have done first of all kind of such surgery where we have replaced the valve without opening the chest. It's called transcatheter aortic valve replacement. We have done such two cases in recently, one on 80-year male and one on 70 years male, where we have done through the femoral vein or femoral artery, we replaced the valve without cutting chest. So that is something new. We want all newer modality in East Africa region, and we need to treat all the patient with minimal operative risk, with minimal cost, and at their home.
Okay, all right. Well, I like the fact that you are referring to advanced technology as treatment, and you keep referring to it's just a prick that we give you, and then we transmit the treatment through the valves and the veins, which is showing you advancement of technology. But also as Mediheal hospitals, they are bringing the treatment now closer to us as Africa, because one of the challenges has been, yes, you have to go to India, you've been referred to India, perhaps you've even booked yourself an appointment in India, but the transition from here to India requires you to get a passport if you don't have one, or you renew a passport, or even just prepare your passport. It requires you to get a visa, and that visa is not guaranteed, and things like that. So it puts a lot of pressure on the patient, as Dr. Patil did mention. And so the point is that they're bringing this new advanced technology closer for the aid and the quickening of the patient. Now, if you know of such a patient, how can people get in touch, Dr. Patil?
Yes, we are starting clinic in here only. In Uganda, we are starting clinics where they can get daycare treatment, initial treatment, and they can get diagnosed. And even Rwanda also, we have started our cardiac clinic and hospital. And our main and state-of-art hospital is in Nairobi, Third Parkland, Medihill. And where we have this cath lab, because we need something called cath lab and cardiac OT. And that eventually, once things will work well, even we are planning to start here. Yeah.
All right. Thank you so much, Dr. Patil, and thank you so much. I trust that this information has been very valuable and informative for you here in Morning at NTV. We take a short breather. We return with more conversations.